Welcome to the Pregnant Bitches podcast.
I'm Jessie.
And I'm Amanda.
And we're just a couple pregnant bitches navigating motherhood together.
Hey guys, welcome back to the Pregnant Bitches podcast. We are so excited for today's episode. We have Dr. Amira here, who is, welcome, who is a pediatric allergist from Toronto, Canada, where we're from, and also my son Arlo's allergist. So welcome.
Thank you.
We're so excited.
So happy to see you outside of clinic.
Outside of clinic, it's a lot more fun here. We're so excited.
We have
a
ton of questions.
Ton of questions from all our followers.
Oh my.
I'm very excited to go through them.
It's like a very thick package.
We have a nice thick package here.
Lots of.
So let's do it.
Okay.
Do you want to start? You want to take it away?
Okay, Dr. Amira, tell us a bit about yourself, how you became an allergist, and what you've been up to lately.
Yeah, for sure. So, I'm a pediatric allergist. I initially went into allergy, honestly, because I had allergies growing up. And it's this whole thing in medical school where you want to be hardcore, right?
Yeah.
Emergency doctor, ICU, Grey's Anatomy surgeon. And no one took allergies seriously. But I grew up with allergies, and I felt like it's such an important thing. And 30% of people have it.
Yes.
Right. Wow. I didn't know that.
Isn't that huge?
That is pretty big.
And it's climbing, right?
Wow.
And so when I went into medical school, I always liked kids, like Arlo is life. But I went into pediatric allergy specifically just to help people and do things that are new and research, cutting edge things that people didn't really pay attention to before.
So interesting.
No one took it seriously, but I think it really impacts people's lives. I'm sure
100%.
I'm texting you all the time.
Yeah, literally.
I don't know what is my child okay? When he got stung by the bee, I was like, is he okay?
She's like, he has hives.
Like
That's
no one.
it's scary.
Also, a lot of people don't even think about allergies unless they have, like you or my husband who has it, until they are pregnant and having children.
Totally. And so I think that it's such a niche and it's such a big need. And so I went into it and I love my job. So super happy to be here and answer your thick package of questions.
No, it's true. You don't think of it as a mom, if your kid has something on their skin and stuff, you're freaking
panicking
the fuck out.
Yeah.
There's that. This is actually the first question because it's funny is, do you have to give your kid an allergy test in the hospital parking lot?
Yeah.
I think that's what a lot of moms fear.
We'll start with that.
I have to give.
Did you guys do it?
No,
so I didn't, but I made sure my husband was home who's anaphylactic. And I was literally staring at him, literally checking. I think I made him naked. I was like, and he was fine for a couple of them. And now we know he has 5 allergies, but we'll get into that.
Yeah.
But a lot of moms do that.
Yeah, because they're scared. They think it's gonna, they're
gonna pass away or something the first time. No, this is a great question. I get this question probably 6 times a week, right?
Oh my God.
And I actually have these families who are, number one, so scared to start allergens because of this exact thing. So do you need to sit outside, an emergency department? Obviously, I'm gonna say I don't think you need to do that because first of all, if it makes you feel better, there's never been a fatal reaction for a kid having their first allergen. That's actually not happened.
Yes.
So right away, that provides reassurance.
Yeah.
Also, these kids are super resilient. You're starting with a really small amount. So maybe they'll get a couple hives. You'll kind of get an indication that, okay, maybe my kid's not good for this.
Right.
So no one's going and giving 16 peanut butter spoons, their first
just a little taste.
You're doing a little taste. You might get some hives or something. You're like, okay, maybe Arlo's not good with peanuts or something. And then you just stop and then you wait it out. Let's see if they get better. Of course, I think we're blessed in Toronto. We have emergency services and whatnot. I do have some families that live super remote that I might say look, maybe I prescribe an EpiPen in case.
Yes.
Right.
Or maybe you do be closer to the city because, you're nervous. But, most people do it. It's fine. You don't hear stories of my first time my kid had peanut butter, anything happening.
I've heard it's the second reaction is that what's a bit scarier.
Yeah, so that is a bit of a myth, actually.
Okay.
Yeah, so a lot of people ask me that too. That's a great question. You can react on your first time. It doesn't have to be the second time. Really, the severity of reaction depends on more than which time number it is. It's actually how much did you have? What's your kid's state? Are they sick that day? Are they okay?
Smart.
Are they eating other things? Is their stomach full of cereal and then a little bit of peanut, or is it just straight up peanut butter?
Right.
So it's more than just the timing. It's more what is your child in that moment?
Right.
So look, a lot of people do the whole emergency thing. It's not going to hurt.
No.
But I'm very curious how many of them actually end up going to the emergency.
Right. That's actually
it's
smart.
true.
I know.
It's true.
Good question.
Yeah.
Following into that, I know there's a question here. I actually remembered it. I don't even have to read it. Because you said you would prescribe them an EpiPen. Someone asked, should I have Benadryl or one of those on hand in case there is a small reaction?
Yeah. No, this is like my favorite question ever because I am not a fan of Benadryl, and I think most allergists are not. I mean, the first thing is Benadryl is a very old medication. It's not very specific to binding to what we need it to bind to. So what we call is like it goes into the brain, it makes the kid tired and adult, actually.
Yeah.
It's very sedating. And so a lot of time you don't actually know, like, is this child lethargic because they're reacting?
Right.
Are they lethargic?
Oh, it's like worse, actually.
Yeah. Exactly. It is.
And they pump that in the States.
I know. They're just like, bam, bam.
When I took Arlo, not for an allergy or
Yeah.
anything, they're like, just give him Benadryl. I was like, well, my doctors in Toronto tell me not to, so I'm not listening to you.
Good.
Literally, I told them
love
that.
this
I was like,
advocacy.
no.
That's scary, actually.
I'm like,
I never thought of it.
Claritin?
Like, I've taken Benadryl when I thought I was around a dog and I'm a little bit allergic, so you just like helps like.
Right, but
Yeah, but take
Claritin will do the same thing.
Exactly.
Right.
We call it second generation. So
Okay.
things like Claritin, Arius, Reactin for people in the States like Zyrtec, because that way it's not crossing into the blood-brain barrier. It's not causing you to be sedated, and
you
you're
won't
still
know.
functional.
I'm horrified. Not that I gave my kids Benadryl, but like I'm horrified that I didn't know this.
No, a
And
lot
it's
of people don't know it.
No, but it's scary that, like-
and we do have a lot of listeners from the States, more so
Yeah.
than in Toronto, and they pump Benadryl in the States.
But the lethargic thing is actually what scares me.
Yeah, it makes
because you
sense.
don't know if your kid is lethargic from the allergy,
No.
and then you think it's on Benadryl,
No.
and then they're sleeping, and next thing you know, God.
Exactly.
and that Reactin liquid works wonders.
Yeah. Thank
Like
you.
child Reactin.
I've never.
I carry it around with me because
Yeah,
that's
right. You
obviously,
need it.
if something happens, that's my first. Like, I would give him Reactin
Jesus.
first. And then if obviously it got worse, then we'd be stabbing him.
Yeah.
Oh my God.
Have you stabbed before?
Yeah,
Oh.
we did. With cashews. That's how we
Oh,
met
yeah.
you. That's how we met
Yeah,
you. It
yeah,
started
I
with the
remember the
cashews. Yeah,
cashew.
Adam stabbed him. I was so unwell.
Yeah. But he
Thank
didn't.
God you had a husband with that knows
No,
EpiPens
but
and
he
stuff,
knows
'cause
EpiPens, but he still called 911.
Yeah, but I think that's the right
911
thing.
calms you
should.
down and walks you through
Right.
it.
Right.
And then
'Cause
there's
you're-
me like standing there being like, I'm gonna pass out right now. Like he's stabbing. I can't. But then he's
did he get
totally
better?
fine right
So,
away.
Yeah. That's so key, guys. Like, I think people give Benadryl. They try to like push their kid to get better with more and more Benadryl. You give a dose of Epi, your child is like turning from 0 to 100.
In 2 seconds.
It's like literally magic.
Yeah.
It's
and
so
the like
fucked.
best outcome is early Epi. So kids
Yeah.
who do the best are the ones who get Epi early. So
Interesting.
yeah, I always say like, what are you even scared of? We have adrenaline. Like adrenaline's
It's
pumping
literally
in
just
me
right.
right now.
So what is an EpiPen? Like
It's
what's in it?
adrenaline. It's
So
adrenaline.
it's literally shooting you with adrenaline.
yeah,
You're
like adrenaline shot. Yeah,
Literally,
your hands
that's
are
how
like
he
shaky.
behaves. Literally, that's how he behaves.
Yeah, it's true.
Like
It
you're
was
like literally like this.
that honestly freaks me out more than him like freaking out from the allergy. It was
He's
like, okay, I'm good to go now.
Yeah.
Oh my God.
I know.
That's
They're
kind
like-
of crazy.
But it's amazing because like their bodies.
Yeah.
And then how long does that last before
That's
you
a
have to
good
get to
question.
emerge?
Oh,
Or
okay.
like what happens
Yes.
after?
That's a good question. So I just want to be clear. It's not the EpiPen that we're nervous about. Like you're
Right.
not going to merge because of the adrenaline.
Right.
It's actually because sometimes you can have a second reaction to the food itself.
Gotcha.
So it's really, actually during COVID, there was guidelines saying like because of COVID, if you give your child Epi like 1 dose and they're perfectly fine, you could actually wait at home. Because most patients, like over 95%, will respond to 1 dose of Epi and they're fine. Like I'm sure
Interesting.
Arlo only got 1 dose.
Arlo
He's
got
living
1
his best
dose.
life. Yeah. And so it's not about the EpiPen that we're nervous about. So it runs through your body. You feel better. It's great. And then, of course, there are some more serious kids and cases where you need to give 2. And then, of course, emerge is really important because they're having multiple reactions
Right.
to the food, though.
Right. It's like it's a lingering reaction. That's like what Adam's
That's
story.
what Adam has.
had a secondary
Oh,
reaction.
No.
Yeah.
Oh, I didn't know that.
He's just all over the place.
No, but like it makes sense because you don't know.
You
I
have
guess.
no idea.
You can't predict.
No, I
Yeah.
just carry like 7 EpiPens with me wherever we go. The bigger the bag.
Yeah.
Jeez.
I
But
literally
is
just, like,
Ace allergic
prescribed,
to anything?
literally.
Ace, yeah, not yet. We haven't figured it out yet.
She's like,
waiting
she's
to
like,
go
I'm
in.
in trouble.
I'm
Oh my
traveling when we get
God.
back. We're going to figure it out.
That's
I
crazy.
can't. Okay.
I think some people want to know like how. Sorry,
She's so excited.
No.
I love
Okay,
it.
go. What do people want to know, Jess?
like how come some people have allergies, some people don't? Like I think people think maybe if you do something in pregnancy,
Oh, yeah, good
you're gonna
question.
have a higher chance. Like if I eat peanuts in pregnancy, my kid won't have a peanut
Yeah.
allergy. Is that
A
legit? Is that a thing, or is it just like a thing
Makes
we
you
made
feel
up?
better.
Yeah.
Yeah.
So there's no clear evidence right now that like eating it during pregnancy actually makes a difference, to be honest. So why you get allergies is number one, like genetics, of course, like case in point, I guess your husband and
My
son.
husband has it.
And
Yeah.
then her son has it. The second thing is in the environment, right? So we live in a very clean, they call it hygiene hypothesis, that we live in a very clean environment. Our bodies are not used to fighting infections and whatnot. So it kind of starts to get allergies. And that's one of the hypotheses. And then the other thing is early
Interesting.
introduction. Yeah.
Oh my God, I never thought about that.
that are like lazy
Like in the
immune system.
olden days, like it. Not that it was dirty, but it definitely wasn't as clean as what we do at home and what we do at work. And I never thought about it.
So are there more allergies in not North America, or less allergies outside of North America?
Yeah. There's like very few in developing countries.
We got to be dirtier.
Yeah. I'm throwing them in mud and I'm going to be like, what?
Literally.
I knew it.
We did.
I knew being
Think about
clean
it. We
was
were
a
like,
bad thing.
the passy fell on the floor. We were washing it with soap. Like, especially in the beginning, first kids. Second kids, maybe that's
why
doesn't have
Ace
an
probably
allergy.
doesn't
Ace
have an
literally is like, fuck everything.
True.
And like, I'm like, passy on the ground, great. Eat my shoe, great.
Yeah, Benny
do
licks
whatever
the
you got
bottom
to
of
lick the
shoes.
dog's mouth. Go for it. Arlo, we were like, don't touch anything. Don't look anything.
You made him bubble boy.
I literally made Arlo bubble boy.
Yeah, so they think that like there's evidence to show that, you know, we're not fighting infections. So our body, like we have two arms of the immune system and it's like allergy or infection. And so that's one of the things. And
Interesting.
Yeah, but
Makes
eating
sense.
it during pregnancy, they don't think right now makes a big difference. Breastfeeding, there's some possible exposure through your breast milk, but we don't think it's enough for it to like really prevent allergies. Like the key thing is giving your child, when they're developmentally ready, between 4 and 6 months, all the allergens, which is why she's like,
Ace is way past that.
Fuck. No, but I think it doesn't, like so let's say you missed that window. Like, okay, you do the window, you get
Let's say Amanda missed the window.
Yeah, you
She's
missed
asking
the window.
for me.
asking for a
Then
friend.
what should you do?
Asking for a friend.
Yes, this one right here.
So, I mean, the window is a suggestion based on the study called LEAP study. So it's like 4 to 6 months if they're developmentally appropriate to eat. Like that, if you give them these foods, you can prevent like up to 85% of cases of food allergy, which is huge.
That's a huge.
Yeah, it's huge. And it's actually a huge shift because if you probably remember, I mean, not in our generation, but they used to say avoid all allergens. So you're like 1 or 2, and now it's like completely flipped. But if you miss the window, I mean, doesn't mean that you shouldn't try. It's not like we're 100%.
You missed.
You have you know. So as I've told Amanda, I'm like, how old is Ace now?
2.
But you don't give him anything?
No, we gave him some allergens.
She did a good job.
Didn't continue it, which will be a question that I'm going to ask.
Yeah.
Like I did it, but then that's what happened to Arlo. And
Took a
I
break.
didn't
One and
continue
done.
giving him cashews, and I didn't continue giving him peanuts, and here we are. And he had exactly what we just talked about, that initial like hives around the mouth. And then we saw Dr. A and she was like, yeah, it's peanuts.
Oh, she's like, I gave it to him. But it's really important that you talk about like what she just said. It's you do it once, but you have to keep it in their diet.
Okay.
Yeah, I think that's the biggest thing too, because so many kids then also have allergies in schools and whatever.
Yeah.
So you slowly pull back all these allergens. Mostly nuts. Like egg you can give at home, that's easy.
Yeah.
But like I would
Nuts
give,
you have to give at home. They don't give
they
it
don't
at
let it at
schools.
school, but like I would give Ziggy nuts as like a snack.
Yeah.
But then like next thing you know, he has nuts. He's touching. Like
It's
you have
scary.
to be very
It's
careful.
scary.
Like,
So
it's
there's this question
tough.
where it's my child had a reaction to peanuts. Will this likely be the same for other nuts?
The answer is no. A lot of people have that myth. They think if you think about peanuts, it's a legume. It grows on the ground. And then tree nuts are from trees that grow in trees. And so it's actually, peanuts are much more closely related to things like lentils and green peas and things that are legumes. So tree nuts and peanuts are not allergic. However, what happens is kids get a peanut allergy and then they avoid the tree nuts and then they become tree nut allergic. So like if you come in, I would say like, oh, your kid has peanut allergy. I really highly encourage you to try the other tree nuts ASAP. So it's
to stop like and further allergy.
Or else you turn into Arlo.
What's his allergies now?
He started with cashews and pistachios. And then I tried the peanut. Peanut was actually the first one because of Adam. Obviously, we did it maybe for like a week and then we stopped because I was like, Arlo, like Adam can't stand the smell of it. Adam can't kiss Arlo after because he can't stand the smell of it. He was the first kid. You're like panicked. So there was no peanuts in his system. Then we went to Florida. There was a little bit of peanut residue in a blender.
That was recently.
Yeah.
Like a month ago.
Literally. And then I texted her and I was like, hi, I think he has peanut allergy and he has a peanut allergy. Because I never gave it to him. You got to push the fucking nuts.
Yeah, I got to do
push them.
Twice a
Don't
week.
do what I did.
So luckily for me, my seed oil journey, I cut out seed oils in my kids' diet. And then the only snack to give them on the go that I didn't have to make was nuts. So then he was like 2 years old munching on almonds and cashews and whatever. It was easy, but like it was a benefit that I didn't know was a good thing now.
No, it's amazing.
No, it's scary.
Yeah. And Benny, you gave him all the nuts already?
Yeah, I don't even know if I've given him all the nuts, but I feel like as a second kid, it's just like out. Like my house has nuts.
You're gonna
so I have cash.
Yeah. The kids are smart though. Like, you know, for example, I have kids that are 8 years old who get diagnosed with peanut allergy and parents say exactly what you said, like second, third kid, it's out, it's in the environment. But what they do, they'll literally take an M&M and suck on it and spit the peanut out.
Yeah.
Oh God.
They're smart. Like they feel a little itchy. They don't want it. And then they're like, meh, I'm not eating that. Or they'll just spit it out.
Wow.
So I support that it's around, but you got to be like, put it in the smoothie, make some curry chicken.
Don't do what I did. Don't be me.
We're making nuts for dinner.
Okay, going into that, likelihood of outgrowing FPIES to peanuts. Can you also tell us what FPIES stand for? PFIES and FPIES. Reintroduction advice for infant with FPIES allergy to 3 foods.
Okay.
I think it's FPIES.
Is it FPIES or PFIES?
Okay. Unless I learned,
it's FPIES. That means it was typed out wrong.
I think it's a typo.
What is FPIES?
Okay, it's super long. Are you ready?
We're ready.
Okay. Food protein-induced enterocolitis syndrome.
Jesus.
That makes sense, though.
Yeah, right? It's like when you put it out, food protein. Right? Induced. Enterocolitis means like inflammation of your colon area. Syndrome, right? So what it is, it's this condition where a child will eat a food, okay? And there's a big range of them. There's some common ones like eggs, peanut can be there too, legumes, grains, sweet potato, banana. Okay, I feel like I had to say all of them. Anyway, so they eat it, and it's interesting because what happens is it's not till like 2 or 3 hours later, they vomit like you've never seen before. Like, remember like that old movie Exorcism?
Yes.
And there's like,
yes,
it's like that. And parents will say that to me. I'm not even trying to, they'll be like, oh my gosh, it was like that. And this little human vomits like the most you've ever seen it. It's out of control.
That must be horrific.
Yeah, it's horrific. The good news is that most of them outgrow it by the time they're 3.
There you go.
And it's not something you can skin test. It's completely like a clinical diagnosis, and they don't need an EpiPen because it's not respiratory. It's all enterocolitis.
I didn't even know that
so
was
basically
a thing.
the food goes in, their body's like, no thank you, comes right back up.
Yeah.
And then I guess you just have to figure out which one of the foods it is.
Exactly.
So,
and
do you avoid it?
You do.
Do you avoid those ones?
Yeah, you avoid it. Like the eggs are an exception because we will try to do baked egg kind of early. Same with milk because some kids will be able to tolerate in its baked form. But, the other foods like sweet potato, avocado, etc., we usually say, okay, when you're 3 years old, come back, we'll bring you and we'll try it. And then most of the time they've outgrown it. Fish and shellfish, unfortunately, tend to be a bit lifelong. We're unclear. But yeah, no, it's actually wild. The one thing that's really hard with FPIES, if let's say you have it to peanut. Now like, oh great, you have to avoid it till you're 3.
Then you're creating an allergy.
You may.
Yeah.
So it's a hard
I've never even heard of this.
One. FPIES is coming out. It's actually firstborn.
No, we got so many questions about
FPIES, it. It's like much more recognized. People back in the day just thought, okay, my kid has like an intolerance, like whatever. And they just avoid it for a little bit and try it again, vomit again. And because it's so delayed, you don't even think, right? You're like,
you don't think.
Right, you ate lunch at 12 and like 5 p.m. 3 p.m. they're puking, or maybe they're puking in the car. Is that like
they think it's gastroenteritis? They're like, maybe
it's a virus. Screw out.
But it was like raspberries.
Oh wait, did something just happen to you guys?
No,
our kid would always puke in the car.
Always puke in the car, but I don't think that had anything to do with it. But okay.
Didn't Arlo have an allergy to eggs also?
Arlo had an allergy. It started with the raw eggs, and then we did the latter, and now he's not eating raw eggs, obviously, but he basically can eat a scrambled egg. He won't eat a scrambled egg, but he'll have French toast, which is basically
on that level.
On par.
Proud of her. She did the latter.
I did the latter. What's the latter? You go baked goods up.
Yeah. Like the more cooked the food is, the less like allergenic. So you start with like baked muffin and cookies, then you do like pastas, waffles, and then you do like hard boiled, scrambled. Wow. You know what's crazy? I went to school for 15 years and all I know is like the different temperatures of eggs.
Yeah. There you go. Literally.
Like what is my life?
Literally.
Okay, so on that camp of like intolerance, allergy, whatever, how do you know the difference between an intolerance and an allergy?
Yeah, so this is a great question. Yeah, this is I think like the most common question I get. So allergy, we define it as an allergist, like as something that's IgE mediated, which IgE is an antibody that causes allergy like what Arlo has, where you get hives, shortness of breath, vomiting, problems with like, staying awake. Sometimes you're very lethargic. And so you have multi-system involvement. And usually with that, like it will respond to an EpiPen and usually you'll have a skin test that's positive. So that's like a true allergy, okay? Then there's intolerances where people will describe something like lactose intolerance.
Right.
And that's where more or less you might have like gas, discomfort, maybe looser stools, but I can't skin test for that. It's not looking at IgE because it's not IgE mediated, and an EpiPen's not going to make your bloating feel better.
No.
And can you grow out of like an intolerance potentially more than an allergy?
Oh, that's a good question. I don't know if it's like I don't know if they've compared like which one you grow out more because it depends on the food, right? So for example, egg allergy, like 95% of kids outgrow it versus peanuts like 10%. So it's hard to like clump all of them together. But like an intolerance, for example, like lactose intolerance, depends on the cause. You could have it because you had a virus. And it's usually transient, but then you could be like Asian and they have a gene where they don't have it and then they tend to have it for life. So I think it depends on like what it is, but more or less intolerances are more GI related.
Yeah. Right.
Well, it's like me and like gluten after kids.
There you go.
I break out into hives if I eat too much gluten. I'm fine. Like I'm physically fine. I just break out into hives and then it goes away.
Interesting.
That feels like a more allergy.
Oh, okay. Will you test me?
Maybe. I should break my 18-year-old rule. I don't know. I mean, I can't give you medical advice.
If you have hives, you have an allergy.
Yeah, I get like hives like on my arms and then they would like go away.
I'm like, maybe we need to send you to an adult allergist.
Okay, guess I'm going to an adult allergist.
Thank God you have 7 EpiPens at home.
Yeah, literally.
We're all unwell.
Does it matter where the hives come?
No.
It's just hives.
Hives.
Yeah.
So interesting, my son got hives all over his stomach one time, and we went to an allergist, and she was like, he has cold urticaria, which is like, what is like?
Yeah, cold urticaria is like a whole other shebang. It's not really food related, because hives are just a like one symptom. It can be caused by food. It can be caused by a virus.
Right.
It can be caused by cold. Water, heat. Like there's a million causes of hives. It's just a generic thing that can happen. So with cold urticaria, it's basically when you are exposed to cold, you get hives. It tends to go away though.
Yeah.
After a couple of years, and usually you actually do need an EpiPen. We usually do prescribe one. I don't know if they did.
They did prescribe one. I never got it because I was like, does he actually need it? But
where'd you put him, in the cold water?
It was in the city of Toronto pools in the middle of summer that don't heat it, and it literally was like his whole body.
We do usually do EpiPens because sometimes their body like gets so overwhelmed with like histamine release that they can anaphylax.
Just get an EpiPen.
Yeah, or just borrow one of hers.
I have like 8.
Yeah, it's true.
8 from Arlo, 8 from Adam.
They put them in.
She has a shop going.
I have a shop going.
All different
Black
ages.
Market EpiPen.
No, I thought it was strange that they just prescribed me an EpiPen. I was like, I have no idea how to use this. Like, what am I gonna like? It was just like,
oh man, I should have brought one. We could.
I was like overwhelmed because I
don't have it with me. I have no kids or husband right now.
You have a gluten allergy though.
But the new ones, I may have a gluten allergy. But the new EpiPens, they talk to you.
Yeah, the Allergex.
What?
Allergex. Yeah, they talk to you. They're like...
They've actually been around forever. They've been around the same amount of time. And then now there's like going to be a nasal one potentially coming out soon.
Yes, I saw that.
Did you see my little post?
I saw that.
I saw like, it just like...
Yeah. Like
Narcan. No one wants to stick a needle.
No, and the kids get freaked out. Yeah. You get freaked out. And everyone's like...
Genius.
I know, it is genius. It's out in the States, so TBD.
Yeah, and Dr. A posts about it. So check her out.
Me.
You already kind of did
Do you need to be referred to see Dr. A, and how do I book an appointment?
Yes.
This is for everyone in Toronto because we're from Toronto.
Yeah, Ontario people. Yeah, so you do need a referral from like a family doctor or a pediatrician, just the way the ministry works.
Yeah.
And then I can see you. Yeah, as long as you're a child. And
how do you like? I guess you would go to your regular doctor and say my kid had like hives and whatever, and they're like, great, I'll refer you to an allergist, and then you have an appointment.
Yeah, exactly. Because I think like one of the more common things, and I just wanted to touch on the hives situation because you asked me about depending on where it is.
Right.
So like one of the things that I think a lot of families have when their kid first eats an allergen, they take the allergen, they rub it on their skin, and they're like, did they get a hive? And I'll say, and they'll be like, oh my God, they did. That means they're allergic. And we actually now discourage that. Hey, like we want you guys to put it right in their mouth.
Yeah.
Because sometimes, especially in Canada, they have eczema, dry skin, and they get hives when food contacts them. And then people think their kid's allergic, but it's not true.
Right.
It's just, we call it contact urticaria.
Yeah. Right.
So we actually encourage the opposite. We like put Vaseline on their face and like put like the food directly in their mouth. So it does kind of matter where it is, because if it's just like local and it's from just touching, then usually we don't think it's always an allergy.
Right. Interesting.
Yeah, because you could put sometimes like pasta sauce, like red pasta sauce as a kid.
Yes.
On the kid, not as a kid. And
I was actually going to say, like, that was my biggest thing when I had my first kid. He would eat food, and like we eat food as adults in our mouth. They eat like this, and they're like rubbing tomato and eggplant, all these like acidic-y vegetables, and then he would have this crazy red rash here, and I was like, oh my God, he's allergic to tomatoes.
Because they're sensitive. Like their skin is so sensitive.
But it's not an allergy.
No, it's not.
I feel like I just saved myself like 200,000 referrals.
Literally. And then the biggest one also is, okay, talk to us about starting to introduce allergens. Like from the beginning, basic.
Yeah. Let's do it.
Go for it.
I'm ready.
I feel like that's the biggest
Yeah,
question.
I feel like that's going to make the biggest
question.
impact.
Yes.
Yeah. So I mentioned earlier this study called LEAP, where early introduction leads to preventing food allergy in many cases. So starting at 4 months, if your child's developmentally appropriate, but up to 6 months, of course, and everyone's going to have like a different kid with a different window.
For sure.
And you would start. So there's no like order. You're not like, okay, I have to do this first or that first or whatever. I just tend to do peanuts first just because I feel like it's very common.
Mm-hmm.
So the way you're doing this is, number one, you can get like a butter of some sort, peanut butter. But if you don't have that, you can buy peanuts and just crush it, obviously, for choking hazard purposes. And you can mix it with stuff, like put it with applesauce. You can even mix it with your breast milk because it's a bit of a thick consistency.
Right.
Or formula, whatever you're doing. Mix it up, make it a bit more of a texture that the kid can actually swallow.
For sure.
Yeah. And then you just do, I usually say like a tip of a teaspoon, wait 15, 20 minutes. If the kid's doing well, give maybe half a teaspoon, wait 15, 20 minutes. And then if they're okay, you're trying to aim at the end of the day for at least like a tablespoon or 2 by the end of it. And you're trying to do that twice a week.
Right.
Ongoing. So even though you do it once, okay, great. But now like doesn't mean it's done, right?
No.
You want to keep it going once they've had it. And I say after you've done each nut and you want to do each one, like you want to do cashew, you want to do almonds, you want to do pecans. Then you could just like mix it together, like make a blended situation, and then just pop that in twice a week and something.
So you would get every single allergen in.
Exactly.
Like I had a friend, she like pulverized the nut and then puts it with yogurt and then it's just like a little bit. That's the only way to do it.
Yeah.
I actually didn't do it like that.
How'd you do it?
No, I just like only really did peanuts, I realize now.
You really fucked up too.
Am I going to be back here? Are you going to be getting a referral
here? Oh God, fuck.
No.
I didn't do all the nuts.
I think Benny's fine.
I mean, like, what? So, like, let's say I never gave. I mean, I guess he could have a pecan allergy one day because I never gave him pecans.
Yeah, it is.
But I guess like if you do feed your kid food over time, as like time goes on, like there is nuts and crap and all kinds of food. It's not the same, obviously, as this
active exposure
measured way of doing it.
Yeah. I'm doing it measured because I'm like, as a physician, I'm like, I need to know, did you do this? Did you do that?
100%.
And it's same with like eggs, dairy, like yogurt. We say like do bread or wheat, soy, sesame. Hummus is a huge one now. Tahini.
Yeah.
Got to get that in
Yeah, my
early.
sister-in-law has a sesame allergy. And like,
sesame is huge right now.
Yeah, I know.
that's shitty. That's a really bad
Arlo's
one.
kid. Arlo's kid.
Arlo has a baby?
Arlo
Are
has
you
a baby.
grandma?
Has sesame, and like that's really hard. I'm sending school lunch. Like you can't bring challah, you can't bring bagels. Like everything has
Sesame is actually in some ways worse than peanut because like it's on so many things. It's in Asian food with sesame oil.
Yeah.
It's in Lebanon.
That's
like
a really hard one.
That's why like it's one of my most common oral immunotherapy foods. You know how I was telling Amanda, like our clinic does something called OIT where we give the kid a little bit what they're allergic to every day to build tolerance.
Interesting.
Yeah, and then by the end of it, like they're able to have like 2 spoons of tahini, so that if they're at school or like
it's
they
not
go to
the
restaurant,
end of the world. if they have a tiny bit.
or if they have tiny bits,
it's usually
fine.
like in a hummus, or like drizzled, and then like oh my god.
And a lot of these kids, if you do it super young, I say like under 3, many of them, by the time we're done, they're eating like lots of tahini, and to the point where we actually will give them like 5 tablespoons and say, look, you're not allergic to tahini anymore. So it's like, it's awesome.
Well, yeah, that's it. My friend had like really anaphylactic allergies to nuts and different.
Andy?
Josh's brother too. Yeah. And like they outgrew them. Or not outgrew them, but like the allergies shifted over time. Like, yeah.
Like in adulthood they did?
Yeah. Like she had a really bad like pistachio. It was actually all nuts. And then she got retested and it was just pistachio and cashew.
Yeah. So like 20% of people outgrow it. I think that's a good question too. Like, can you outgrow food allergies, right? So like we talked about prevention, trying to give all the foods early on, and then after that, keeping it in their diet twice a week. But let's say you already have a food allergy. What does that look like? Usually we're bringing these kids back every year. So I get to see Arlo every year.
Yeah.
And see him grow up. Oh my gosh, he's so big now.
He's so big.
And so, about 20% of kids will outgrow peanut. Tree nuts are like 10 to 20%. Sesame's like 30%. So each food has like its thing. But as you get older though, the chances are not as good.
Right.
That's what we know. Like their immune systems are just like a bit more fixed. And so as they get older and older, then we test a little less frequently. And if they're super young, we'll try to do immunotherapy.
Yeah.
Like
Adam's not outgrowing peanuts right
No, he's done.
Yeah.
But Arlo, maybe if you do some therapy or something.
We're going to start with Ace and then move on to Arlo.
What do you mean?
Giving Arlo a break. I don't even know if Ace is allergic to anything.
Yeah, she's
yet.
still like
we're going to start with like the basic beginning and then move on.
At like
then I'm probably going to do that with Arlo.
So like let's say you have one sibling, the older one with an allergy, like what's the chances that the younger one has it too?
Yeah, so the chances are higher, but there's no like
exact.
And that's what I'm saying. Like a lot, we're actually much more encouraging of families. Like someone like Arlo has a peanut allergy, and I'm like, Ace, like he's 6 months, like let's go, let's get it in him ASAP, because then you have a potential ability to prevent it from happening. So food allergy is super complex, and like there's so much we're doing and learning, and now there's even an injection for food allergy that might be coming. That? So like in the States, it's already approved. It's called Xolair. And so basically people will get this injection, which reduces their risks of anaphylaxis, and it's for adults too.
Wow.
Huh. And we're hoping we get Health Canada approval in Canada. Like, that's what I mean. Like, things are changing so quickly.
Right. They're on it.
They're on it because I feel like it's like taking over North America.
It is taking over. I've never heard, like, I was like talking to my mom. She's like you and like all our family friends, like no one had allergies. Like it wasn't even like a thing.
So it must be a product of like our environment. Really, it's having a negative impact on people.
They think COVID is going to like skyrocket it because we were completely isolated for like 2-3 years. So they think that like babies that are born in that period of time, they're like looking into studies to see, are they even more allergic?
Oh God,
because you can imagine,
Arlo.
Like,
COVID baby.
Yeah. Oh, is he a COVID baby?
Yeah.
Oh.
Asthma, eczema, allergies.
Yes, all of the things.
All of the things.
And then you have your second one that licks boots.
And
he's good.
Literally. And he's not a COVID baby. Ace was borderline.
He was on the
end of it.
Yeah, he was on the end.
Yeah.
He was when the world reopened.
Yes.
Yeah. And he got all the bacteria.
Yes.
Yeah. But Arlo and Ziggy were full COVID babies, like in the hospital
everything
with
closed.
masks.
Yeah.
Everything closed, no visitors, no nothing. Like,
oh my gosh.
Yeah, it was rough.
But Ziggy has no allergies.
That
we know
of.
Just the cold.
The cold thing. But Josh had that.
Oh, okay.
My husband.
So there you
go.
Really?
And that's maybe the genetic.
Yeah.
I don't know.
Yeah, we usually, yeah. We have to touch on that a little bit after.
Yeah. I'm going to get your input.
Because then we do like, if the dad has it and the kid has it, then we have to do a little bit more workup.
Yeah.
As an
See,
FYI.
the allergist didn't do any
Did you tell them that the dad had it?
Yeah, I think so.
Oh, okay.
I don't know. I told my doctor.
Not all allergists are good, doctor.
No, I didn't feel like
I feel like I'm actually working. Like, give me your health card number right now.
Literally. To be honest, I didn't feel that taken care of, I have to say. Like, I would have felt
But you know what? It's funny that she says that because who we went to before, I forget who we went to before you in the beginning, never showed me how to use an EpiPen. And then like I came to see you and you're like, do you know how to use an EpiPen? And I'm like, no.
Yeah, no, I'm very like,
but like I'll take 10, like, but I don't know how to use them.
No,
I know.
To do the cold test on Ziggy, we went and sat there and they put like a lukewarm ice pack. Like it wasn't even in the freezer, it was in the fridge on his hand, taped it around and waited 5 minutes.
Did
and
it
then
come
she's
out?
like, nope, there's no hives there.
So he's good
and
to
I was
go.
like, okay, here's the photo of like horrible hives on his body. But sure.
Oh no.
Yeah.
Yeah, look, I mean, obviously I can't speak to other allergists, but like we try our best. And and I think also based on like where you trained, how recently you trained, maybe, you know, you remember more things. I'm also like semi crazy and like I'm like very thorough. So.
No, I want that.
You want that. You want that though.
Yeah, but sometimes I'm like, do you know how to use EpiPen? She's like, I have 8. I'm like, do you know how to use it?
Yeah, literally.
And I'm like, okay, let's go through this
If you're
together.
going to prescribe an EpiPen, you should be giving me a lesson. Because Josh did his finger when he was little.
No, he didn't.
Yes.
Did he still have his finger?
Yes, he
Okay,
does.
thank goodness.
Why? Because you could lose your finger?
Yeah.
Wait, what?
Yeah, because
this is good. No, not part of the questions. It's a
you
great
guys have
question.
dropped your package. You're like, I'm going for a free for
We're going off the cuff.
Off the cuff now. Okay, wait, let's go back into that.
So because you don't have a lot, remember epinephrine, it's adrenaline, it causes vasoconstriction. So your vessels constrict to like increase your blood pressure to the rest of your body. So the thing about your finger and any other kind of like limbs, if you're a boy, is that there's not the ton of blood flow. So if you stab yourself there and you block all the vessels that go to that area, you can actually like
necrosis.
Yeah. So it's a big deal.
I'll tell him that. He's going to be so
That's
lucky.
actually very, very
it's important.
Firstly, happy that you brought that up. Happy he didn't lose his finger.
Yeah.
But if you or your child has an EpiPen, make sure you know how the fuck to use it.
Yes.
People put their hand on the edge all the time, but if you look at the side of it, it tells you how to use it. It says to hold it like this, not to hold it like this.
For that reason specifically, because if you don't know how to use it and you by accident do it upside down, you're losing a thumb.
Blue to the sky, orange to the thigh.
Yes, girl.
That's a good, I like the rhyme.
Right?
Is that why they came up with that's marketing 101 from EpiPen.
Yes, but in the moment though, you're like
you think about it right away.
But you still look at it. I'm always like, still look at it. Look at the picture. Like line it up.
Can't they just put like one massive arrow going down? I guess people then would be like, should I go up?
Yeah, it's like, should it be here?
Yeah.
Should it be
What's
there?
the arrow mean?
Oh,
Yeah.
my
Honestly,
God.
I think, yeah, it's pretty like when you look at it. And then the other thing I always say is it doesn't have to be in movies and stuff. It's like this whole like swinging motion. You just like come to your thigh on the outside and then firmly push for 3 seconds.
Like Ozempic.
Yeah.
Oh, is that how it is? I have no idea.
From what I've seen, literally from Ozempic.
But it's just like a thing.
Literally,
oh,
you
like,
just
no
like
way.
stab
Injection.
yourself. Yeah.
Okay, so if you know how to use Ozempic, you're golden.
Which probably is a lot
We're
of
not
people
on
these
Ozempic.
days.
We saw it.
Amanda's like, I'm telling everyone my life story.
If you were on Ozempic, you'd start to have like the
Ozempic face?
That's what I've heard.
disgusting.
Yeah.
Because it's eating your muscle.
Yeah, but we're not going to talk
Anyway.
about Ozempic.
I actually know nothing, so like I'm not even gonna start to try to pretend. All right.
Okay, so
Did you guys get-
like let's get your top couple tips that you could share with people.
That wasn't on our list.
No, but I just like I feel like if you were a new mom in like their shoes, like what would be your top 3 tips that you would tell them as a pediatric allergist?
Okay.
I love this.
Whew. Now I'm like, okay.
You're on the spotlight.
I am on the spotlight. But it's okay. So the first thing is definitely introducing allergens early. I think 4 to 6 months, go through the whole list, like Google top 10 allergens and make it happen. And then keeping it in their diet twice a week. That's number 1. I think if I had to pick a number 2, it'd be that eczema is not caused by food. I think that a lot of families will come to me and say they want to be tested to all the foods. Can I just get tested for all the foods because my kid's skin is dry? And I think it's because of whatever, tomatoes or whatever it is. And there is no pan testing for foods. I think that's a really important question that like people ask me. Can you just test all the foods? First of all, you have to have eaten it for me to test it because what we're testing is the allergen. Like you have to have the antigen and we're checking antibodies. So if you've never eaten it, like the test is not reliable.
Right.
So I can't do that. Number 1, I can't pan test all the foods. Number 2 is like eczema is a chronic condition. It happens a lot in Canada and especially in this dry climate. And so it's caused by things like infection, dry air, not moisturizing, using scented products.
It's not food.
It's not food.
It's not food.
Stop cutting out all the foods.
A lot of people, and I thought for sure that it was like milk.
Yeah.
Why do people
a lot of people think it's
connected
milk.
then?
I don't know why. Actually, tell me. You guys are the pregnant bitches.
Yeah. A lot of people think that it's milk. I thought
Or
it was
bread.
milk related.
I really thought that eczema more is like a toxin overload in your body of like crap and chemicals
Well,
in
it
your
could be
body,
that
like
too.
trying to get like I didn't think it was.
I think it's genetic. That's like
Definitely
think
a factor. Genetic is a factor. And
I
it's
never actually
and
thought of
environment.
it.
Like it's dry.
Yeah.
You know, like literally I feel like I have eczema right now when I walk outside. Like yeah. So that's like number 2. It's like eczema is not caused by food and I can't pan test your child to all the foods. You know?
She's not testing your child.
Yeah. I'm not testing because it doesn't make sense.
Point. Like it's like I think when adults say like, oh, I want to get tested for intolerances, you can get the intolerance workup, and it's like it tests dairy, gluten, and it just tells you like what are you intolerant to. So I think people have this idea in their head that you could just have
you
like
could do that
a panel for
kids,
allergies,
which they can't,
which doesn't exist,
which is like my number 2 because I get it all the time. Like, can you test my kid to all the foods? And I'm like, no, I can't.
Right.
And then I think number 3 would be the Benadryl thing. Like I really am super against using Benadryl. It's like my top, it's crazy because I'm on TikTok and now starting Instagram a little bit better. But like my number 1 viewed videos are always like, don't use Benadryl. And people are so upset about it.
Americans.
Yeah.
It's the Americans.
They're
because
so mad. They're being told.
All the doctors there push it.
Yeah.
For anything, not even just for an allergy, for anything. They're like, sick kid, Benadryl. I'm like, but why?
Your hair's falling out.
But
Benadryl.
like, why?
I mean, like if you understand the American healthcare system in any way, and you know the size of their pharma industry, you know,
They just want to sedate everyone.
like I work.
Take this.
No, but like I work in pharma, and the American healthcare system is very much driven by pharma, and Benadryl is a pharmaceutical. So
there it is.
Would be
so
not
Claritin
surprised.
and reacting kids works wonders.
It's a great thing. The other thing people say is like, oh, well, Benadryl's the only one approved for kids like under 2 or under 1. And I'm just
Is
like, use
that
a little.
true?
Yeah, so like it is true. So I just say like, just use a little less of like the normal one. Like Reactin. When I say normal, I mean a second generation. I'd rather
Why hasn't Reactin? I'm shocked Reactin hasn't done a study.
I don't know,
in
pharma. You tell me.
Because Benadryl takes over.
Yeah,
but you
because
could easily
in
do a
Toronto and
study.
in the States, there's Benadryl for kids under 2.
Yeah, that's the thing.
So they took
and
over.
Claritin and Reactin
2
do not have
It's over 2.
Yeah.
But I gave Arlo many times Reactin, just like what if it's a 5 ml, I'd give him 2.5.
Exactly.
See, so doctors can not prescribe you this thing, but they can recommend off label.
Yeah, 100%. I mean, I'd rather you use something that's not going to sedate your child.
Yeah.
That's fucked up.
Yeah,
That
but
is
a lot of
fucked
people
up.
don't know.
Yeah. Like in certain countries, if you're on Benadryl, it's actually considered a medication that you can't drive on. It's like equal to being on like alcohol.
No, that's actually the Benadryl thing freaks me out.
Yeah. Dude. Throw that stuff in the garbage.
I don't ever take it.
But if I took Benadryl, can you imagine what would happen to me if I took Benadryl? I'd be high.
Yeah.
People are high.
No, yeah. Like I've taken Robaxacet. Like I've taken some of these like medical drugs and I'm like, I'm fucked.
Yeah.
Like actually fucked. Yeah. Like I can't function.
Yeah. They did a brain scan of people who are on it and it shows like their brains are like lit up. It's not supposed to be in your brain, right? Like you're supposed to be targeting like the hives and things, you know, not your brain.
No.
But I also think it's like our parents' generation, they grew up with all their programming
1000%.
too. So like if my kid has an allergy, it's like
totally
my mom or my mother-in-law or that generation, they're like, give Benadryl. And I'm like, I don't think we're supposed to.
I mean, now, you know, people used to like smoke every day. Like, people, like, you know, I feel like
soon alcohol's
we're in a whole other world than what like our parents did.
And it makes sense. There's more research coming out and more information.
Yeah.
So
and there's better drugs out there. Like back then, Benadryl's the only thing. I get it. Like,
use what you got. Or your kid dying, you're gonna give the fucking Benadryl.
Exactly. All good, you know. But now it's like, dude, there's like way better options. Like,
okay, so lesson learned: don't take Benadryl. Take Claritin, Reactin,
Arius, Zyrtec.
Zyrtec's in the States, right? Zyrtec
just in the for States. Your people. Yeah.
So that's great.
Those are my top 3.
Love it.
Amazing. Okay, guys, that was amazing. Dr. A, thanks so much for being here.
We learned so much.
We learned so much.
You guys have no more questions?
No.
We have no more questions. I think we're
tapped out the entire booklet.
Literally.
Okay.
The whole booklet's and everything in our heads.
All the random things that just came out.
All of it.
Well, I have questions for you guys. You know what? I feel like I've been put on the spot for a while, and it's like my turn to get
now?
Yeah, it's your turn.
Okay. Shoot.
My first question is, when would you say if someone was in their first trimester, I don't know who, when should they tell people that they're pregnant and how do they do it?
Woo, are you trying to tell us that you're pregnant, Dr. A?
I may or may not have come on Pregnant Bitches pregnant.
Woo! Wait, you should definitely go on a podcast and tell everybody. That's when you should do it.
Is that how I do it?
Announcement. Imagine. Like, woo!
Hey, world.
We're here. Well,
when's the right time?
So we're not doctors.
No, but like I don't think it's not even a medical question. No, but you guys are pregnant bitches.
Your kid. Which kid it is. Like for my first one, I waited till like 4 months, I feel like. I waited so long. I was scared. I was anxious. I waited till all my tests came back. I waited till like the genetic test came back. Like I was just like, didn't want to tell anyone.
Gotcha. Did you do like the amniocentesis thing?
No.
So what genetic test? Like you're talking about?
There's a NIPT test. Like that. They don't do amnio anymore, I don't think.
No, they do.
What?
Yeah.
On you?
I mean, I haven't.
On you?
Are you okay?
Yeah. No, but
they wanted
I'm
to do
shocked.
it on me.
I'm curious to hear your story too. But so you wait till like 16 weeks basically.
Yeah. It was also COVID at the time, so I wanted to see people to tell them. But like
yeah, we didn't have to see anyone. Yeah, like, no one would have known.
But I was like really anxious and wanting to tell everyone. On my second kid, I peed on a stick and called people.
Yeah.
Oh, right away.
Like right away.
Yeah.
Wow.
Right away.
So like a 7 week versus 16 week.
The guy was like,
not even 7 weeks, like 4 weeks.
Like 4 weeks.
I literally when you find out that you're pregnant.
Peed on a stick. I went to dinner with my friends 2 days later. They're like, why aren't you drinking? I'm like, I'm pregnant.
Yeah.
So I don't have the energy.
So yeah. So the first, same with Jesse. I didn't tell anyone till 12 weeks. So as soon as the NIPT you can get by 9-10 weeks. As soon as that came out cleared, 12 weeks you get your ultrasound. Mm-hmm. I got my first one I think at 12 weeks.
Yeah.
And as soon as I saw the baby, everything was healthy. And NIPT said, I was like, okay, I'm pregnant.
Yeah, it was a boy?
And I knew it was a boy.
Yeah.
And the second, I think I peed on a stick. And right away. I was like, I'm pregnant.
Interesting.
Yeah.
So you guys are both boy moms.
Both boy moms.
Yes.
Too.
I'm a girl mom.
Oh,
yeah.
Congrats.
I know. She's ready to attack the world. No. So, okay. So that's the thing. It's so interesting because this is my first child.
Yes.
And it was definitely an unexpected pregnancy for me. I had this like whole birth plan and like when I was going to do it and all of that. But whatever.
Yeah.
Like life's life.
You'll learn quickly. Kids fuck up your plan.
Yeah,
literally.
Clearly. I'm like, okay, great. I need to find a pediatric allergist that's trained in OIT tomorrow.
Yeah.
But that's cool.
Yeah.
So I was like, everyone's, debating. And, I was like, do I wait to 14 weeks, 16 weeks? Some people wait till 20 till they have the anatomy ultrasound.
Yeah, a lot of people wait.
I'm like,
it's preference. It's totally preference.
Wow.
Also, you tell people you're comfortable with. Obviously people like have different stories or like they have miscarried or they have
that's so
all
scary,
that stuff.
this miscarriage thing.
Yeah.
I think the biggest thing is you tell the people that you're comfortable with it, where they're going to support you.
Yeah. Regardless.
So regardless of the outcome. So that's my biggest.
I told people that I would have told the story either way too.
Right.
So God forbid something happened, they were going to get called no matter what. So I was like, if I tell them I am and then I'm not, it doesn't matter.
And they're going to support you either way.
True.
So it really just depends on who you are telling.
And so when you told like these people, was it like a social media post or were you like just telling family? And when did you post on social media?
With my first, I think we told our friends first before we posted. The first one was like the balloon and everything.
The whole thing.
And the second one, like I got the NIPT results. My doctor texted me. We had a good relationship. And I like gave Adam the phone and he looked at me and I knew it was a boy. I was like, kind of like looked at me and I was like, okay, and that was it.
Yeah, I think we posted on social media later in the first.
You did later.
I like called everybody. I was like sending pictures of the ultrasound or like doing like this on FaceTimes, and then eventually I posted later. I was like back then I wasn't like a huge social media person. Like probably
now
if I got pregnant again on this account, I would post it like once it was like cleared. Honestly, I would post it early again.
Honestly, I think
talk about the journey.
Yeah. I think people just don't want to post or tell people if they have like a work situation and they haven't told their work yet. And there's the whole like, because it's like it has a big impact and like you have to start to plan and Also from a personal perspective, I think the first time too, it was kind of nice to like be pregnant and private
not tell anyone.
and like have it to yourself. And then like once you tell people, it's like the questions start and what are you doing?
How are you feeling?
It's like, oh my God.
Yeah, it's true. I don't want those questions.
It's a lot.
I didn't even
What are you doing for the nursery? What's the baby's name? When are you going to have the baby? Are you going to have it at the hospital? It's like
all of the things.
Yeah, so hold it in and just tell the people that you want to tell.
Yeah. No, the thing is it's like really hard because you feel like an absolute piece of poo.
Yes.
And like no one, I feel like warned me. I mean, I understand you guys do on this amazing podcast, but like I wasn't pregnant, so I wasn't following like
100%.
You know what I mean?
100%.
And then it's like all of a sudden your entire body is like slammed with fatigue and such bad nausea. And I took this diclectin thing. I was so foggy.
I was so fucked up on diclectin.
I'm a physician. I'm like, I can't take this.
No,
like,
I couldn't take it.
I need to be sharp. So I just would like literally low key like go and like barf in between like patients.
Ugh, yeah. Awful.
It is awful.
And you're not telling
kids
anyone.
are vomiting all the time because they have FPIES. And so I'm like, that was them.
Wow.
That was them, literally.
That was them. That smell, it's them.
Yeah.
It's never me.
Yeah.
No, but it's true. Like people, we have to function in society. Like I feel that's a huge thing. Like
yes.
I never thought about that. They really should give women the first trimester off.
I think we should get it off.
The first trimester. Then go
really
into, you could work honestly until you give birth.
Well, it's like now you have COVID.
I feel amazing now.
Yeah.
Right. It just like switches.
Literally, I thought I was never going to be happy again.
I know.
Yeah.
And Amanda kept saying, it's going to become like, are you sure? Because I think I'm going to never be happy again.
And one day you wake up and you're fine.
And I'm like, whoa, I just want to go to the gym.
Yeah.
Like, what is that about?
The first is rough.
I know.
I think that everyone should get, at least like weeks like 6 to 12 off.
Yes.
Yeah.
Like
because 0 to 6, you kind of don't even know you're pregnant
if you're not feeling good.
Yes.
Yeah, of course.
If you're fine, like go for it.
I'm so jealous of those people who are feeling good.
Yeah.
I've yet to meet one. Are you one of the ones?
Yeah.
Where you're just like, I'm pregnant and I'm amazing.
Yeah.
Oh,
I know.
I low-key hate you.
I know. I was a happy pregnant person.
Yeah.
I was
the whole time.
I was never sick.
My
like
sister's
maybe
like you.
a little bit.
I was not.
Okay,
on
no,
the
it's
second,
not like a maybe.
But
it's
I
like,
wasn't like anything to this level.
No.
I don't like talking about it because I feel bad.
You feel guilty.
Mom shame.
Yeah. Like I was like, I'm sorry for you, but I was fine.
I was perfect.
No, you never know. You really never know.
But then you have other issues. Like you never know what you're gonna get. You can get the back pain. You get this. You get that. You get the reflux. You get like you don't know.
reflux.
Yeah.
I just started getting that like 2 days ago. I have to sleep like this.
The heartburn.
What do you guys do for that?
Fuck, what's that thing called?
Tums? Because I tried Tums.
Tums and Gaviscon.
Oh,
Gaviscon's stronger.
You get it on like Shoppers?
Yeah, Gaviscon. It bubbles in your mouth and you're like, huh?
Oh.
I didn't have that.
I'll never forget one of my friends came over. It was me and Blair, we were pregnant, and one of our other friends came over. And I think Blair and I were literally 7 weeks pregnant. Like we did not have any heartburn or anything. And she was like, I think you should take Gaviscon because like you're pregnant. Like you're supposed
You're taking 7 weeks.
Gaviscon. And Blair and I are like, we're fine. Like we don't need it. And she was pushing it. And we're like, okay, well if she says we have to take it.
And that's it.
And we're literally just popping
oh my God.
Gaviscon. And we were totally fine.
You're going to pee your pants laughing.
Okay.
So just like heard it, like just like because you were bullied into it.
Literally bullied into it, but like first time moms go through this. You're like
I don't know.
You're like literally Googling and you're like, it's telling you to do this. And you're like, okay, like I'm gonna do it.
You have no idea.
You have no idea.
That's literally.
But you do not need Gaviscon unless you have heartburn. Like there's no need.
You don't need to start popping pills.
I take so many pills. I'm like, okay, every day I'm like reading a new thing. Like you need DHA. Like, oh my God, you need more folic acid.
I know.
And I'm just like, I take like 5 pills a day now. I'm just like so over it.
I know.
And for the first trimester, I'm like, every time I'm drinking, I'm like, how am I supposed to do this? Like, they should have like an alternate
100%.
form, like an absorption patch.
I agree.
I literally,
Nighttime was my best tip to take it at nighttime.
Yeah, I started doing that. So I just like, I'm unconscious.
You're unconscious.
No, the worst thing about pregnancy is like you're constantly thirsty and then you constantly have to pee. It's like it's a never ending cycle.
Yeah, like literally this podcast, like I've been thinking about those only 2 things.
Yeah.
Like how thirsty I am and that I have to
Oh my God. Also, but this is mom life. I have to go.
You have to go. Yeah. Well,
I have to go pick up Benny.
Do it. Do your mom thing. Mine is still like in this cocoon.
This is the easier stage.
This is the easier stage.
They eat what you tell them to eat. They do what you tell them to do.
Which is like pizza and bread.
It's easy.
And then it comes down
and then you try to do a podcast.
Exactly.
Go give them some nuts.
Exactly.
Well, congratulations. And thank you so much for being here with us today.
My pleasure. Because now I feel like I can, now that I'm pregnant, I feel like it'll be authentic. Like even on my posts and socials.
Yeah,
I can like talk about these food things.
1,000%. It's going to be great.
It'll be even better. Because before I was just like advising. And now
and how do they check her? What's your handle?
I'm at Doctor. So DOCTOR and then Amira, AMIIRAH. At Dr. Amira.
Perfect. We're going to tag you. And we're so excited for this episode to air.
Yes.
We love you and we'll see you next week.
Bye, everyone.
Bye.